Okay, let me hit on a couple of additional concepts here. Confidentiality is one, you're very familiar with this if you've been to the doctor's office, anywhere that you've been with healthcare. They make you form a, make you sign a HIPAA form, which is Health Insurance Portability and Accountability Act. Basically, what this says is your health insurance or your health information is protected for confidentiality, so you cannot share the information with anybody. Translate to you as an EMT, if you transport Jim's mom, you are not supposed to tell Jim that you transported his mom or what was going on. You have to be real cautious with any of those things, especially if you are out and about and you're eating lunch somewhere and you're talking with a partner about a call you just had. If you say enough about it that somebody around you can put together who it was and those things, then you're violating confidentiality. You can get yourself in quite a bit of trouble with that. So it is your duty to maintain confidentiality for anything that the patient tells you. The only people that's allowed to have access to that information are people that are directly in the patient's care chain. So when you transfer the patient over to somebody else, whether it's a higher level emergency provider or you transfer them over to a nurse or somebody like that, those folks, you can give their information, everything that happened and all of that. They're allowed to have that. A workaround with the HIPAA violation is peer review. You are allowed to share information on patient situations when you're doing it for QA/QI, which is quality improvement or quality assurance. You can do that with patient information, so keep that in mind. I'm just going to keep on going here with some additional stuff. Documentation, this is real simple. There's a bunch of different ways to document: SOAP method, chart method, narrative method. There's several different ways to document. What is most important here is, one, understand the PCR, which is the patient care report. Sometimes you'll hear it called the ACR, the old ambulance call report. PCR, ACR, same principle. It is a documented history of what happened on the call. There's a lot of information, a lot of places that have got to be information's got to be filled in for insurance purposes and all of that. So your provider, whoever you're working for, will stress the importance of putting certain things in the narrative, making sure certain boxes are checked. A lot of this stuff is really important for the evidence-based medicine. The PCRs get reported up to a national database, and that national database provides us the opportunity to do research on certain types of calls and things. So it's really important to make sure the information's in the right place. Most important thing to remember as far as documentation is concerned, if you don't write it down, it did not happen, period. So whatever you do, make sure that you document the patient care, the things that are done. If it was something abnormal and you need to document, additional events, things like that, then you want to make sure you do that, because if you have any length of time in your career as an EMT, you will be called to court at some point to testify. The better your narrative is on your PCR, the less chances that you're going to get called into court to testify, because everything they need is right there in your report. So the better your documentation, the better chances you have of avoiding court. Doesn't necessarily mean you can have the best documentation ever and still get called to court. So keep that in mind. But you want to make sure that you document everything very well. Make sure you spell check it. Make sure you use proper terms, approved abbreviations, because if your PCR gets called into court, then depending upon the circumstances, there's always a chance that one attorney is going to try to tear you apart and make you look incompetent, so that we'll get the PCR thrown out of court, or it will give the reasonable doubt, if you will, into the the people that sit there, the 12 jurors. Brain fart, sorry. But that is what can happen. So make sure your documentation is nice and clean, everything's spelled right, proper grammar, so that it's professional, it looks professional, and it doesn't give them anything to try to tear you apart over.